My name is Juanita Valdez Cox, and I am the director of this organization, La Unión del Pueblo Entero, or LUPE for short. LUPE was created as a community union, and it was created by the leaders of the United Farm Workers, because when they were organizing farm workers, they could deal with the grievances, they could deal with wages or working conditions in the fields. But when those farm workers got home, the issues of education or health or immigration, housing, all of those issues still needed to be addressed. That's why Cesar and Dolores felt that besides the United Farm Workers Labor Union, we needed a community union to deal with all of those different issues that we had.
So today you're seeing the mobile clinic, the Vision Mobile Clinic. This is a partnership with a community hospital called Doctors Hospitals of Renaissance. This is a partnership for vision exams, low-cost vision exams. These are clinics that we take out into the community, into colonias and our LUPE offices, and that offer low-cost vision exams to the community. One of the barriers that we have here in the Valley is lack of access to healthcare. And so the way that LUPE works as an organization is we hear the issues, we work on issues that the community, that our membership base wants us to focus on.
We worked out an agreement with the DHR to encourage them to come out to the neighborhoods, the colonias, where we work, because a lot of people don't have access to come all the way to the city. There's a lot of variables on how people can get arrested coming this way.
Because of the valley being so close to the Mexican border, and with all the issues on immigration, we had to figure out a way to provide the health services in a way that was accessible, in a way that was not expensive. And because we were dealing with all of those issues in immigration, we knew that this was something that was needed. People couldn't, because of all the fear, especially with this last administration.
In the Valley, we had a large gap of people that couldn't qualify to have Medicaid, but they also couldn't afford to enroll into an Affordable Care Act program. And so from there came the need in the community of pushing more and asking for healthcare access. And so LUPE was able to create partnerships with local hospitals and local clinics to be able to take mobiles out into the colonias to meet these needs.
What we're seeing is here in the Rio Grande Valley that we're really trying to cater to folks that have a difficult time coming to us. So community organizations are very important, certainly to us and other institutions, because they really have the pulse of the community and the folks in the community. A lot of times where organizations like hospitals or other businesses can't really go regularly or have the relationships to go, we're trying to reach out to them to educate the community so that people can start asking questions and have a dialogue. When we find that there is that dialogue there, people start to understand, they get engaged, and better things happen. They are able to connect to healthcare services which previously were unavailable to them, which may or may not be free. A lot of folks think that because they may or may not have money to cover that they are not eligible to receive those services, and that's really not true. We're here to kind of bridge that gap, and these mobile units are helping us do that.
They get close, they can go to the churches, and which is close by to a lot of colonias. There's an intimidation factor that makes people not want to come out this way, and that kind of prevents them from getting access. Aside from income status, right? There's not many job opportunities out in colonias.
LUPE having this service out in the community has been a great help. Many people have gotten vision exams for the first time. We started seeing 500 patients, and we're up to 2,500 per year.